what age, does age filter into your treatment decision? If we're on a first line, we'll see if people agree.
Yes.
Is there anything else to guide our choice between NSAID and bedivenlimab?
Okay. Duncan, I hope you are still hearing us.
There?
Yes, you are there. So maybe you can add your point of view, your experience in this discussion.
As long as bedivenlimab treated dogs are greater than a year of age, so that we're on label, I have never seen age as a discussion point. If a dog has osteoarthritis-associated pain, then options for first-line treatments, in my mind, are non-steroidal anti-inflammatories or bedivenlimab, the anti-NGF mAb. And Masataka and I were talking about this recently because we've heard it come up in other conversations. And he reminded me that in the study we just shared with you, there are a couple of dogs, young dogs, who got bedivenlimab. Tell us about how easily the owners noticed the difference.
Yeah, so actually two dogs they received bedivenlimab during the study, and the owner immediately saw the difference, and both of them had hip dysplasia, and the owner saw clinical signs before the injection. But after the injection, owner said whoa, my dog is acting like a puppy again. It's okay, great, yeah. So even young dogs, they respond to Librela.
So I think probably just mirroring what questions I've been asked about that age, if I'm okay to continue, because I think this is a really interesting perspective, is that people express concern over how long they would be treating the dog for. So if they start it at 2 years of age, is there any concern for continuing this into old age? And I very much feel like we probably don't have that long a follow-up on any set of dogs at this point. I mean, the launch in Europe was, 4 years ago?
You were there.
Yeah, exactly. So I'm not sure. Are you aware of any population that's been treated from a young age longer than, anything we might have seen?
Because you started at 8 years, eh?
Yeah, and how exactly? So they would go at 8 to maybe 12 now. Still not the ones that start at 2 years old and now are 6. And do we get data on when they are 10 or 12 or 14?
Yeah. So this is a question which actually...
Is that a valid concern even?
It's exactly the same question that came up when non-steroidal anti-inflammatories came out. There was this fear of long. But
it's good to bring it up because it keeps coming up.
Yes, and so what clinicians do is not treat. And I think that's wrong. I think if pain is there, treat it, because the cumulative deleterious effects of pain over time are very difficult to deal with later on in life. First point. Second point is this: we've got to get rid of this idea of continuous, unchanging, lifelong treatment. Anyone who's suffered from chronic pain knows it's dynamic. As you treat, everything gets better. Now, the reality is that, and going to my experience with non-steroidals, as I've treated for several months with non-steroidals, the dog gets to a position where you can start to decrease the dose, back off treatment.
Yes.
Librela is going to be no different. We've just got to learn that from treatment. So let's get rid of this idea of saving treatment until things are really bad, and let's get rid of this idea that any treatment is lifelong and unchanging. Treatments have to be adapted, should be adapted both down and up if necessary.
Exactly. The disease changes, the pain changes.
Duncan, would you say, would your mechanism of that possibly be something to do with central sensitization?
Yes. Tony, you've hit the nail on the head. So when we treat a dog with pain, we're treating a very altered system. As we effectively treat that pain, which is what bedivenlimab does do, no doubt about it, there's less input into the system. Central sensitization has a chance to back off, to disappear. Higher center changes, increased anxiety, the fear of pain catastrophizing, all of those things have a chance to reverse and normalize. So as everything gets better, less treatment is needed. We have to, again, we think of, it's bizarre to me. We have talked in veterinary medicine about the deleterious effects of pain. We haven't talked about the benefits, the cumulative benefits of pain treatment. And so, it goes both ways. If pain causes deterioration, treatment of pain can cause reversal back to a normal state.